Right now, hospitals across the state are working to address chronic worker shortages. Healthcare workers are still in high demand as the industry tries to recover from the pandemic. And that lack of staff can sometimes impact patient care. KENS 5's Victoria De Leon is live with how this is affecting one San Antonio hospital. Victoria.
Yeah, Audrey, here at Texas Vista, the hospital is operating near capacity nearly daily, and not because they don't have enough beds, but because they don't want to stretch the healthcare workers they do have too thin. So today we were able to talk to some staff about what they're doing in hopes of bringing more nurses and doctors in.
Once infected with the pandemic, staffing shortages still plague this South San Antonio hospital.
So definitely the biggest thing that I hear from nurses is I'm tired.
Vanessa Olivares sees the stress, burnout, and anxiety up close.
Our nurses were going through stressful times because we are taking care of 6 patients to 1 nurse. We're taking care of sometimes 7 patients, especially during COVID, because we just needed to stretch ourselves as much as we could.
Things have been more manageable since the height of the pandemic, but many nurses chose to quit altogether.
So today, I could easily choose to hire an additional 40 to 50 nurses right now to get this hospital properly staffed for the patient care that we'd like to do.
Other nurses switched to contract traveling positions that paid more than hospitals could compete with.
And we had to honor that. We can't afford the cost of the agency nurse because the agency nurse receives a higher salary, but then their company receives another cost of overhead.
While budgeting to pay staff more, the hospital wants to ensure workers are also taken care of mentally.
We give them breaks as much as possible. We try to, work with their schedules so they have some time to be with their families and kind of recharge themselves to come back. We're trying to make that culture happen, a positive culture, and it's happening and it's changing. It takes a while.
Now, in addition to putting a bigger emphasis on more pay and work-life balance, the hospital is also working with local colleges and universities to help recruit future healthcare workers. We're live from the South Side. I'm Victoria De Leon, KENS 5.
Thanks so much, Victoria.